Duncan Hemba, KTN News.
Now, cancer misdiagnosis even before actual disease is identified seems to be something common across the country. Not having quick, early and accurate tests is something to worry about among cancer patients. Late diagnosis is likely to push families to the wall, forcing many towards poverty as they strive to cater for medication. KTN's Nicholas Wambua explains.
Meet 50-year-old Sami Munyao. He's a malignant melanoma cancer patient from Kisingo, Makindu, in the county of Makueni. His symptoms were misdiagnosed and came to learn of the truth much later when the disease was at an advanced stage. He says that if only his cancer had been detected early enough before spreading, then it would have been treated.
Si makosa madaktari wetu, serikali weka mashine inua mashine ziko na nguvu zaidi. Ile mtu akifimwa anapatikana kwa haraka nini kona shida na nini inamsumbua na tibiwa kwa haraka chenye kinamsumbua.
Given the persistent headaches, medics in Makindu thought Sami was suffering from stress.
Nikienda hospitali wananiambia nipunguze mawazo ndio nyingi, ndio inanifanya fresh ipande zaidi.
For 6 months, Sami was under tuberculosis treatment.
Nikapatiwa madawa ya TB 6 months, nikaambiwa nikunywe madawa. Nikaendelea na kukunywa hii madawa, ndio kati ile mtu anakutumia madawa ya TB nayo. 2
years after his symptoms were written off by Makueni medics as TB, he was diagnosed with cancer.
Walipochunguza, risoli zililetwa, nikaitwa kwa simu, nikaenda mama watoto. Sasa ningeweza tembea peke yangu. Tulipoenda, tukapata hiyo barua ya kwamba ni kansa. Tukaambiwa zaidi ya yote ni kansa, lakini
as the world was marking the International Cancer Day Thursday, Sami is living testimony of the many difficulties facing cancer patients in the country, misdiagnosis being the biggest of them all.
Madawa nilipitia ya TB, nisikuwa na TB. Lakini haikuwa makosa daktari kunipatia. Daktari alikuwa anataka kunisaidia. Makosa ni mashine za kupima kwa haraka ugonjwa patikane ni nini.
At the Makueni Referral Hospital Cancer Center, the number of cancer patients continues to rise. Currently, the facility serves 285 cancer patients who are in weekly clinics. 70-year-old Stephen Mudhoka is one among patients booked for the day. He had been brought in for immunotherapy. The diagnosis stages have been the most difficult.
If we had a diagnosis, or rather the diagnosis could have been done in a public hospital, I'm sure it would have been a little bit cheaper. So I think for me it's a wake-up call to the government.
Our numbers increased because patients were not able to access treatment to either Kenyatta or Machakos.
Medics say that some cancers are difficult to diagnose since they require advanced tests.
Reason being it mimics other conditions like skin cancer and nervous system. Due to these reasons, most of the patients will find them they are being treated for other things like people will think about the TB, and even as they establish the treatment, there will be the spread of the disease. During the staging, you will find that due to that delayed process of diagnosing it, the disease has already spread.
In the county of Makueni, like in any other parts of the country, the number of cancer patients continues to soar, with breast cancer being the most prevalent. Nicholas Wambua, KTN News in Nairobi.
And for news closer to home, the Standard Media Group has unveiled its top editorial